Vaughn, who can be found at St. Anselm College at the Institute of Politics, with a question from one of our viewers. Jen?
Josh, thanks again. This is Mr. Don Parrish, who lives in Bedford, New Hampshire, and he has this question for the candidates tonight.
How will you ensure that cancer patients have access to affordable and quality health care insurance?
Mr. Brown, why don't you field that one first? Mr. Brown, why don't you field that one?
My wife's stepdad just passed away from cancer. We did the Pan Mass Challenge trying to fight cancer. Dana-Farber and other entities do wonderful jobs. We need to make sure that we have the ability for people like the gentleman who asked the question to have access to good and affordable health care. Unfortunately, Obamacare doesn't do that. We have a mechanism, we can have a mechanism in place that addresses people's concern, the pre-existing conditions, the catastrophic care, and other types of things, but we need to do it better. We need to take it back to the states. I voted 5 times against Obamacare. Senator Shaheen was the deciding vote, and she was there. Remember, it started at ground zero, where you can keep your doctor, your hospital, your insurance company. Well, that's not the case. There are insurers, and I'm not sure about this gentleman's situation, who had care and coverages, who were dealing with those situations. As a result of Obamacare, they've lost their coverage, and they're in peril, and they're nervous, and they're scared, and I understand. I've heard their stories. I want to get back down there and repeal it so they can go back to the plan that they liked and trusted.
All right, Mr. Smith.
Well, clearly, thank you for the question, and it's a terrible, terrible disease. I don't think there's anybody in America that probably hasn't been affected by it one way or the other, either having it themselves or knowing a loved one or a friend who has. So my view is that we need to prioritize, and we spend a lot of money on illegal aliens, which we shouldn't be spending any money on. That's one thing. We waste money in huge programs like Common Core that should not be, aren't even constitutional. So if we really want to provide for the health and welfare of a nation, which obviously clearly would be finding a cure for that horrible disease, cancer, then we ought to put the priorities in order and do it. But I do agree with Senator Brown and what he said about Obamacare. Obamacare is not helping. That's not going to help. You can't even have your own doctor. You may have a doctor that you like very much who may be pursuing whatever the illness is and following it, and then suddenly you can't have that doctor anymore. Doesn't make sense.
Mr. Rubens.
My mom passed away of bowel cancer many years ago at a very young age. My mother-in-law, however, was cured of cancer recently by advanced technology. This is one of the reasons that I am strongly in favor. Now, we need to cut our budget because our country is bankrupt right now, but I'm strongly in favor of continuing funding under NIH for research on the basic causes of cancer. And we are learning this. Science is elucidating and illuminating for us mechanisms by which we can cure this dread disease. I differ, however, with Scott on his strange position on Obamacare. You have said, Scott, that you favor Medicaid expansion here in the state. You have said right here to you, Josh, that you favor the structure of the Affordable Care Act, Obamacare. So it's unclear about what you stand for. So what we ought to do with people who might have a pre-existing condition, beef up catastrophic care pools, but we don't need mandates like what you voted for in Massachusetts. We're not going to force people to buy any particular product and service. That's un-American.
All right, Mr. Brown.
Yeah, Josh, what may work in one state may not work in another state. And to correct the record once again, I was one of the first people that said when the legislature was determining whether they wanted to accept federal dollars that beware of broken promises by President Obama and Senator Shaheen, because how are we going to pay for it at the end of 3 years? So I was very clear on that. It's a temporary program, not meant to be a lifelong program to go on forever and ever. I'm the only one on the stage who's voted 5 times to eliminate Obamacare, to repeal it. And I look forward to going down there and leading that charge again.
Mr. Smith.
But the problem, Scott, is you voted for Obamacare Jr. in Massachusetts. And in either case, yes, it's certainly not exactly the same. One is a federal program and one is a state program. However, the individual is the one that should have the right to choose their doctor, to choose their hospital, to choose their health plan, and the family of that individual, not Massachusetts or the United States government, in my view. Massachusetts has a right to pass it. I agree with that. But that doesn't make it right. I hope you're not going to propose to do that here in New Hampshire.
Mr. Brown, quickly.
Well, thank you. First of all, Obamacare has 18 new taxes, cuts $750 billion from our Medicare. By the way, Senator Shaheen's the only one who has voted on this stage right now to cut Medicare. What worked for one state may not work for another. There were other states that also, Oregon, Utah, Tennessee, that were working on plans that were good for them. The federal government wants you to think that Obamacare is the only answer. That's a false premise. It's not. We can develop a plan that works for us. We have intelligent people, good leaders right here up on the stage who I'm sure will want to jump in and help to come up with a plan that addresses everybody's concerns. Because I look at Obamacare and the VA, I see Obamacare being the VA in a couple of years.
All right, thank you, Mr. Brown. We got to move on with the next question from James, which I believe goes to Mr. Brown.
Does. Mr. Brown, there is widespread scientific agreement that humans are the primary cause of climate change. Do you agree with this? And if so, what should be done about it?
Well, let me tell you my position on climate change. I've been out there and had a record on that previously. I have always said that the climate's always changing. And my question and others' questions, is it man-made or is it natural? And I believe it's a combination of both. And the question is, what do we actually do moving forward so we can actually enjoy and treasure our environment, but also use the resources that God gave us to actually become energy independent and not pay money to countries that want to kill us. We have an opportunity to find a balance. How do we have businesses grow and expand when we don't have an energy policy? When we right now have a senator right now who is voting against the Keystone Pipeline, good union and non-union jobs to help us step back from our dependence of that foreign oil, that all of the above approach, wind, solar, nuclear, hydro, geothermal, siting, permitting, letting citizens be part of the process. These are the things that we need to fight to try to achieve, and right now we don't have a plan.